Hey, it's Dr. Livingood here. I want to welcome you. I want to thank you really for your time and being interested in joining the movement and the mission of what we're doing here in the Triangle area. I guess I should start by saying that my name is actually Dr. Livingood. Many of you, I'm sure, are wondering, you thought it at least, had to be a doctor with a name like that. And so I just wanted to bring some vision and bring some perspective tonight to or today, whenever you're seeing this, from a perspective of what you're actually getting into and what you may have the opportunity to be a part of based on what we're doing here in the Triangle area. I guess just let me start by saying this. How are we doing when it comes to being healthy in America? Horrible. Current statistics show 5 out of 6 of you will have heart disease or cancer in your lifetime. As an American, we're 37th in the world in overall, our healthcare system compared to the rest of the world, and 53rd in the world in life expectancy. 20 million Americans with thyroid conditions. I could go on and on. We're sick. We're sick as a country. Why? I just think we're way off from a perspective of doctors truly teaching us how to be healthy, how to be well. And I'm starting 30,000 foot for you, which is fitting as a plane goes overhead while I'm talking. 30,000 foot view for you to help you to understand what we're trying to solve in the city. And it has to do so much to do with that crisis that America's healthcare is in. What is the biggest asset that you have? It's you. If you lose your health today, what does it affect? It affects everything. That means literally every person around you. Like if you have a child, for example, if they lost their health today, what would you do? You would do anything and try to get the child's health back. Everything would stop. Your job would stop. Everything would stop. Health in that moment is the most important thing we have, but we're not acting like it. And so our job and our calling is to help people to get real health care, and it starts from helping them to understand what health is and where it comes from. See, health isn't how you feel. It's not how you look. It's how you function. And if you can function at 100%, the way you were already designed, then your body will work. It's like if you have a cut, the cut will bleed and then it will heal. Well, if the cut can bleed and heal and your healing mechanism is working, right, then why aren't the headaches healing? Why isn't the digestive system healing? Why isn't the cancer healing? Why isn't the neck pain or back pain healing? Why aren't those things healing? Something's interfering with the healing. And so if we can get you moving back towards 100%, you'll heal. If you're at 0%, you're dead. Well, everybody in America, including you, are somewhere in between. And you don't know you have a problem until you get 60% function inside of your body. Or if it's your kidneys, it's 40% function. That's what the research now shows. So you can literally be at 61% and feel fine and think you're healthy. Well, if you're only getting 61% of your paycheck, that's a problem, right? But once you hit 60, now you got the symptom, and then America says, drug it, give you a bunch of pills. And so we just cover this up. We take more drugs than anywhere in the world. We take 75% of the world's drugs and make up 5% of the world's population. It's insane. It's not working. So once you come off the drug, the problem comes right back. And the entire time you're on it, it has all those side effects: liver failure, kidney failure, lymphoma. And so that's our system right now in America. That's not health care. Waiting to get sick and treating sickness is sick care. So what we do here as an office and as our movement, as we branch out to change the way healthcare is viewed and delivered in the Triangle, is teach people how to move towards 100%. What does real healthcare look like? Instead of our delivery system being drugs and surgeries, we have 3 things at our delivery system, because the body doesn't need any help. It just needs no interference to get healthy. So if you can remove the interference, the body will heal and the disease will be overcome. And the testimonials and life change, with 365 of them last year alone, all the medications that people come off of in the drug bin in our office, it all happens when we move people towards 100%. Number 1, we change their thinking. Thinking about health differently. Where does it come from? It doesn't come from the pill. It doesn't come from the surgery. It doesn't come from the doctor. Because I could do all of those things to a dead person and nothing happens. But if I do them to a live person, something works. It's the power that's already inside of you. We just acknowledge that and know that that's the greatest doctor in the world. It's also managing your stress and just changing the way you think in general to be grateful for what you have. This thing called life is so precious. Then we go to the main thing that controls all of the power and all of the healing. The system that the doctor works through in the office, or I'm sorry, in your body. The thing that controls everything in you is your nervous system. Beats your heart, breathes your lungs, tells you to love someone. It controls everything. And so when's the last time you had your nervous system checked at a physical? Never. It's the most important system you have. We're not even looking at it as doctors. That is the first system we start with. That is the therapy side of things, the chiropractic side of things. That is checking the #1 system and making sure that it's moving in the right direction. And then finally, we address the toxicity side of things. America's not moving enough, so we have our 10-minute workout program we created with the Olympic teams we take care of. We're not eating real food, we're eating so much fake food, and so we partner with places like Blackfin and Trader Joe's, and we have meal plans and ways to make it easy to eat well instead of eat sick. And then finally, the toxins that go into the body, teaching people what's toxic that goes on your skin or you get put into your body, or the pans you may be cooking with, or whatever it may be. And when we apply those things and we walk people through and families through, that's when they move towards 100% and they can reach their full potential. And so, I guess if you're wanting to apply to an office like ours and to a movement of what we're doing, I really feel like we're at a startup place. Because we've had 10,000 patients over the last 6 years. We've won countless awards, top primary care physician, taking care of Olympic teams, the Shaw University Bears, creating partnerships. So much has happened. And we really have that delivery system figured out. And we know how to take people from sick, suffering, or before they even know they're sick and suffering, to actually experiencing true, real health. But now we're really looking to branch out to say, we need to change this entire area. There's 1 million people in the metro population of the Triangle, and our job is to change the way that they view and deliver health. So we are creating strategic partnerships and a vision and a strategy to go at how do we actually make real change. To be a part of that then, if you're just looking for a job, we're just not interested in that. Because we're looking to make a difference. And there's a big difference between the two of those. Is that I know at the end of the day you need a paycheck or whatever it may be, but we need people that are ready to dig into that, to go to a place that honestly no one's really been, because we're talking about altering the entire healthcare system of our area. And so we need some people that are really willing to dig into that. And so that's who we're looking for to add to our team. Excuse me, those type of people that want to be part of that process of learning how to do that. So I hope you're that person. If not, I just appreciate that you're spending time with me in our office and giving us your time today to just further yourself nonetheless of your skills. And I'm excited hopefully to maybe be able to meet a couple of you because we're really looking to get the right people on the bus. Excuse me, the right people on the bus. Once we get you on the bus, then we can get you in the right seat. So I'm not going to go into many other details with the position. It's just we want to find out if you resonated with that and then get to know you a little bit better to see if you're going to be a good fit, because we have a lot to accomplish as a company. So thanks for your time tonight or today and whenever you're watching this, and we'll hand it off, and I look forward to hopefully meeting some of you real soon.